Okay, so if you've clicked on this video, then it's really likely that you've already graduated from your physiotherapy course. Congratulations for getting through that, by the way. And you're probably in the process of applying for your first job as a Band 5. In fact, you might already have applied and you've been shortlisted. Congratulations again. And you may or may not have an interview next week. I remember when I was applying for my first junior or Band 5 job after graduating, it was really hard. Firstly, there were so few opportunities, and secondly, when the opportunities did come up, it was so competitive. And when I finally did have an application that got shortlisted, my first interview was pretty disastrous. I was not expecting all the clinical questions that they asked me. In fact, if I had someone to tell me everything that I'm about to tell you now in this video, it would have saved me a great deal of stress, anxiety, and I probably would have nailed the first interview and got my first Band 5 junior job pretty much straight away. If you're new to my channel, then welcome. My name is Matty. I did my Band 5 rotations in the NHS, and after a year and a bit, I moved up and specialised as an MSK Band 6 physiotherapist. And I've been a physiotherapist for the last 5 years. And currently I'm working as a specialist musculoskeletal physiotherapist at a private hospital. So the point is, I've been in the position you've been in. And in this video, I'm going to walk you through the interview process step by step. And hopefully this will get you your first job as a Band 5. First things first. If your application is shortlisted, then you will be invited to an interview. During the COVID, which is when I did my interviews, they were online and they utilize a point scoring system. I'm going to talk more about this later in the video. What should you wear? So a little bit of common sense, guys. Smart attire. Gentlemen, wear a suit or a smart shirt, smart trousers, polished black boots. Make yourself look presentable, have a shower, groom yourself. Ladies, wear a skirt or a dress that goes beyond your knees. First impressions count. And of course, arrive on time, shake hands, have good eye contact, don't slouch, all the basics. Let's talk a bit about the interview structure. So when you come in, you'll see your panel, your interviewers. They'll welcome you, have a little bit of an introduction, and they might give you an icebreaker. And then they'll talk briefly about you. Usually this is very brief. They might ask you why you've chosen to apply to this hospital. And then they'll go into the clinical scenario bit, which is the key part. This is the point scoring system aspect. Then you'll have a practical assessment, and for my interview at least, I had a written assessment right at the end. Let's talk about the welcome, the intros, and the icebreaker. The interviewers are going to welcome you and they're going to introduce themselves. And then there's the icebreaker, which is there to build rapport and lighten the mood. For example, they might ask you, how was your journey here today? Or how did you get here today? How was the drive up? Etc, etc. You want to answer it in a straightforward way, but whatever your answer is, make sure it's positive, and you might even want to add some humor. Then they're going to talk very briefly about you, but this is going to be so brief, all right? Norfolk Park asked me one question about myself. It was, name an achievement that you're proud of. Or it might be, tell me about a time when you overcame a challenge. You want to use the STAR framework, so situation, task, action, result, relate. I've talked about this in my previous videos, so if you need a bit more detail, I'll leave a link in the description below. But the STAR principle here is key whenever they ask for, show me an example or tell me of an example or a time when this happened. When they asked me about a time when I had to overcome a challenge, I talked about how back in my first year of uni, I had a placement, and obviously I'm right-handed. And during the placement, I had a wrist injury to my right wrist. And I showed them my wrists, and I showed them my pisiform bone, which was thickened. It was a flexicarpi ulnaris tendinopathy, which is very rare and really stopped me from being able to write without pain. It really flared up. I basically had a choice, and the choice was I could either stop the placement, heal whatever this was, right, go get physio treatment, and then do the placement another time, or I could just suck it up, improvise, adapt, and overcome. And I chose the latter option because I'm really stubborn and I don't like to quit. So I learned how to write with my left hand in 6 weeks. So at the start, I could not write a single word or letter with my left hand. And by the end of it, I was writing patient notes with my left hand. Yeah, they were really impressed with this because I don't think many people have taught themselves to write with the opposite hand. So that was already something that made me stand out. So you want something that's going to make you memorable. Next, you're going to get clinical scenarios from the different fields of physiotherapy. So you're going to get some MSK, some neuro, some respiratory. You might get some orthopedics. So I'm going to pretty much pick a scenario from each of these, and we're going to go through the kind of questions that you're going to get with an example question, a breakdown, and a model answer. By the way, if you guys want more questions, I've actually made a course, and I'll leave a link in the description below. It's a complete course, complete guide to your Band 5 interview, and it has multiple of these questions with breakdowns and model answers. Okay, so link in the description below. Anyway, back to the video. One of the questions was, you're on the way to do a stairs assessment when the patient complains of feeling dizzy and subsequently falls over. How would you manage this situation? So this is a typical scenario you might get in an orthopedics ward or care of the elderly or someone who's had surgery quite recently. Do not try and catch them, as it's a risk to yourself. That's point number one. Point number two is that if there's a way you can cushion or slow their fall, then do that. Point number three, ascertain the immediate first aid needs of the patient. For example, an A2E assessment. Are they still breathing? Point number four is to call for help from surrounding staff. Point number five is you might call the medical emergency team if required. Point number six is you might call the ward-based nursing team. Point number seven is you're going to transport the patient back to the ward as long as it's appropriate and if it's safe to do so. And then you're going to immediately advise the ward staff about the incident, and you're going to ensure that the patient gets a medical review, i.e. a doctor comes to review them to make sure they've got no damage or brain trauma or whatever, and they might even need an x-ray if they've fallen on the hip, for example. And then you've got to complete an instant report. I've lost which point we're on, but you can see that there's a point scoring system here. And the final point is that you're going to have to tell your supervisor. This could be a band 6, so your direct senior, or a band 7 team lead, and you might even escalate it all the way up to the band 8A manager. The next question is a neuro question. You have a patient who has a left-sided infarct. What would you expect to find on assessment, and what would you tell your colleagues to help them if they were going to be treating them? So there's several points here. We're going to go through them. A left-sided infarct means that the symptoms are going to be on the right side of the body for the patient due to the decussation of the spinal cord. There are going to be deficits in sensation, proprioception, and coordination. Tone is going to be affected. They might have spasticity, as well as anomia, an inability to recall names. Aphasia, which is a language or speech disorder. Apraxia, difficulty with tasks and movements, and verbal apraxia, which is a motor speech disorder. You're going to need to tell your colleagues about these problems in the MDT meeting, and they might need a referral for either occupational therapy or speech and language therapy, or both. Right, so those are your points, okay? You just got to chock-a-block list them and you will get the points on the point scoring system. Let's just say there are a number of points, right? And the question is out of 5. Now, there's 5 possible points. If you score 3 of those points, you're only going to get 3 out of 5. And if you score 4, you're going to get 4. And if you get all 5, then you're going to get 5 out of 5, which is what you want, because you want to make sure you're scoring high on this point scoring system. The last question that we're going to cover is going to be on the respiratory field of physiotherapy. What is the difference between type 1 and type 2 respiratory failure? How might each be treated? So you want to talk about how the type 1 respiratory failure is where the PaO2 is low, but with normal levels of PaCO2. When I say PaO2, I mean like blood oxygen. When I say PaCO2, I mean carbon dioxide in the blood. So type 1 respiratory failure is also known as hypoxia. It's caused by a VQ mismatch or ventilation perfusion mismatch. Examples of which could be pneumonia, edema, ARDS, pulmonary embolism, or PE, and atelectasis. Revise these conditions, okay? These can be treated with supplementary oxygen, so NIV, non-invasive ventilation. For example, a face mask, Venturi, or nasal cannulae. Type 2 respiratory failure is when you have low oxygen or low blood oxygen, but you have high levels of CO2 in the blood as well. This is essentially hypoxia plus hypercapnia. It is caused by reduced minute ventilation and failure of the airway. It's common in conditions such as COPD or chronic obstructive pulmonary disorder, neuropathies, and pneumothorax. It can be treated with CPAP or BiPAP to increase the exchange of both gases. Next, you're going to have a practical assessment. This is usually MSK, although it could be neuro, it could be respiratory. But a good rule of thumb is to prepare for a joint assessment, because that's the easiest thing that they could do. Make sure you know how to do an A2E assessment as well. Make sure you know how to auscultate with a stethoscope. Make sure you know your neuro assessment. But just for the purposes of this video, we're going to use the MSK segment, right? Because this is the practical I had to do in my interviews. Think about your assessment. Think about observation in standing first. Is there any swelling? What's the patella position like? What's the muscle bowl like? Is there any bruising? Is the knee varus or valgus? What's the active range of motion? And then once you've assessed that, you might look at active assisted or passive range of motion. You might then do the power assessment using the Oxford grading scale. And then you might also be asked for some special tests, right? So if they say your patient has clicking, locking, and giving way, what's some tests that you could do, or what do you think it could be? You might say, oh, it could be an ACL injury because you've got the giving way, or it could be a meniscus-related injury because you've got the popping and the locking. But I was asked to perform a Lachman's and an anterior jaw test. Of course, revise your meniscus tests like McMurray's, Apley's grind, and Thessaly's. You might also want to revise your varus and valgus stress testing. Finally, we have the written component, which is the thing that you do last before you leave the interview. I had a question on arterial blood gases. There is no need to know all the values off by heart. It's just not possible for you to remember all of those unless you're an absolute whiz. But they'll give you a sheet of the ABGs, the normal values. But you need to know how to be able to interpret it. I'm going to read to you the scenario that I got, or at least a very similar scenario that I got. You're asked to see a 75-year-old patient on day 3 post-op following a hip replacement. They've been increasingly drowsy and short of breath. The nurses note that their oxygen sats are dropping on room air, and ABG was taken. So their pH is 7.29, PaCO2 is 8.2 kPa, PaO2 is 6.5 kPa, and HCO3 is 26 millimoles per litre. FiO2 is 21%, which is room air. What's your interpretation? So you look at the pH, 7.29, so there's acidosis. There's raised levels of CO2 in the blood, 8.2. This is respiratory acidosis, likely hypoventilation, not getting enough air in. And there's a low blood oxygen level, so that's hypoxia. The normal bicarbonate levels indicate that it's an acute issue and that it's not chronic yet. You would then say the patient is hypoxic and is retaining CO2. This suggests poor ventilation. I would then be really cautious into making them do too much exercise that increases their oxygen demand, because that would make them more hypoxic. I would prioritize positioning and airway clearance if secretions are a problem. You'd also then escalate to the medical team. They might need oxygen therapy or non-invasive ventilation if they fatigue. I'd also reevaluate if they are appropriate for mobilization or if they need further respiratory support first. Obviously, that's a more detailed answer. You probably would only have to break it down in the first point and just say like what it is, what your impression of it is. You might say patient has respiratory acidosis with hypercapnia and hypoxia, but there's no metabolic compensation. After the interview, after they finished asking the questions, obviously, and after you've done the written questions, that's it. The interview is then over. Generally, it's quicker to hear back than it was for your physiotherapy course. You might hear back in a few days, at most a week or 2. The waiting is painful. You're either going to get a rejection or an offer. If you get rejected, that's fine. Life is full of rejection, and it's about looking at what things you did, evaluating your performance, and what you can improve next time. Might even be a good idea to ask for feedback. I mean, they're generally pretty good at giving you feedback. When I did my interview at Norfolk Park, I got quite a lot of good feedback. Now, if you followed this video through and you really listen to the tips, then you hopefully will have your first Band 5 job. Feel free to DM me any questions on Instagram at @TheRealMattChong, or comment them down below on this video and I'll do my best to answer them. And of course, I've made a complete guide talking about how you can pass your Band 5 interview, from the application process to writing a personal statement to the physio-specific CV, all the way to the interview process, where I give way more examples of questions, breakdowns, and model answers. But this is only for people who are serious about getting a Band 5 job, because I know how competitive it can be, and I wanted to create a resource for you guys that you could get access to that will almost guarantee that you get a job, right? Because the last bit of work really depends on you. Catch you guys in the next one. I'm on my own, broken alone. I feel the rain crashing down all around this empty town. I'm searching for the lost and found.